Hello, everybody. It's Don again. Welcome to another episode of the Atlantic So podcast. We are so lucky to have, we are starting our episodes for the upcoming Senate race, and we invited all the Senate candidates in New Jersey to talk about the issues that affect people with disabilities as well as talk about themselves. So we are lucky to have Patricia Mooneyham, and she's going to tell us all about her and what she believes in what we need to do for disability policy. So, Patricia, I'll throw it over to you. Tell us a little bit about yourself and why you're running.
Good morning. So I just want to say thank you for having me here. Often independent candidates are left out of the stage when it comes to politics. The mainstream media seems to think we only have two parties when we know that there are multiple individuals who would like to serve this great state. So just a little bit about me. I was born and raised in New Jersey. The only time I did not live in New Jersey was when I was pursuing my undergraduate degree at the University of Southern California. I have degrees in economics and history from there. And then there was a short period of time when I did mission work in Haiti when I lived abroad for a little bit of that, which is important, I think, for the immigration issues that we currently are struggling with. I am currently a director of professional development at the Harrisburg University of Science and Technology. So very interesting. So I'm not a politician. I like to say I'm running to be a stateswoman for New Jersey, truly represent them. I have a career. I think that's something that Curtis Bashaw, Christine Khalil, and I all have in common as candidates. We are doing this to serve. We all have thriving careers, but we saw a need and we feel like we can fill that. So opportunities like this let people get to know us and realize that not everyone's a career politician. It's, I think, an epidemic in our legislative branches in Washington. And I think that is a big opportunity for change, is to have some folks with other perspectives deciding the direction of legislation for this country. I like to say one of my favorite campaign slogans is Jersey girls get stuff done. I am very passionate about healthcare reform. And I think a lot of the things that you may come up against in your struggles could fall under some of those umbrellas, because I don't think of healthcare as just health insurance. There are definitely challenges where the direction of the Affordable Care Act has gone, but I feel that is not just health insurance. I think it's the pharmaceutical industry. I think it's our food supply. And I definitely think it's mental health availability and wellness around mental health, which is huge, I think, for the community, the disabilities community, right? So isolation and mental well-being and being able to socialize in this age of technology is a huge concern for individuals in that community, right? So I actually participate or actually support something called Global Accessibility Awareness Day. Are you aware of that day? Do we celebrate that here in New Jersey? I know they do.
We know, talk about that. Talk about your support for that.
So it's a great event, right? So in this age of technology with social media, so many remote employment is such a great opportunity for those in the community that may be limited by transportation opportunities or mobility issues and things like that, and who want that independence of being able to be employed, whether it's full-time, part-time. And however, technology can have barriers to people's access, whether it's the types of fonts being used, whether it's the ability to hear clearly, closed captioning, translation, all those things. So Global Accessibility Awareness Day draws attention to that, draws attention to a lot of the resources that individuals, companies, and government can use to better support individuals who need those support in the technology realm. So very important, obviously, for high-tech companies to be aware of those things and building easier accessibility, easier access to those accessibility features within search engines, within browsers, within social media, especially. That's, for a lot of people, that is their social network. That's their ability to connect with other people very easily. So making sure that those accessibility advancements are available on those platforms is a big win for individuals in the disabilities community.
Well, I think that's so true. And I want to touch on an issue you brought up at the beginning because it sometimes doesn't get discussed as a disability issue, even though I always say all issues are disability issues because disabilities makes up 25% of the population, and there should be a disability component to everything. So that's immigration. And what do you think, should be done about immigration? That's a very hot topic. It comes up a lot. So what would you do as a senator in terms of immigration reform and addressing people's concerns?
So, first of all, we know the system we currently have is broken. We also know that we're not getting the support of our neighbor below us in Mexico in solving the problem. And it's not just our problem, it is their problem as well. I I'm a little concerned about that. We certainly should have better diplomacy in place to collaborate with them. However, and that's one aspect I think we should look at. We have the USMCA, which is a trade agreement that Mexico has benefited from greatly. And I'm not sure why that hasn't been used. But I think a lot of that has to do with because the issue's been politicized. So again, the two-party system is failing the voters. And instead of solving the problem over the last 4 years, I think recently there was a policy put in place that very much lowered illegal entry into the country. Now, why wasn't that done 4 years ago? Right. So I do feel like a lot of these issues are politicized because they make for good campaigns for lifetime politicians. I do believe that we need to get industry involved in this solution, make it easier for those industries such as the service industry, manufacturing. They are traditionally benefited from the immigration population for employment, right? So those are entry level jobs that a lot of people don't necessarily want to take. Farm. New Jersey has so much agriculture industry, especially here in South Jersey, that a lot of farmers are dependent on immigrant labor, especially during season, right? So making it easier for people not only to get here, but then deciding how to help them stay here, right? So my understanding is a big part of the problem that we don't hear about is there was a change to the visa process a few years ago, and folks are now here not legally because they stayed past their visa. And there was no way during that time for them to either be, helped back to their country or their visas extended in the proper way. So those people are in flux as well. I don't like the idea of sanctuary cities and sanctuary states. I think that flies in the face of what we should be doing. It sets up an atmosphere for trafficking. It sets up a dependency that most taxpayers are not willing to take on. And I just feel like we should be involving the industries that benefit most from immigration and helping to figure out the best way to solve the problem and to create. I know that one particular presidential candidate is not happy, but look at Michigan, where they actually brought the Haitian immigrants over to help revive industry in that area. Those are the kind of initiatives. And there is a burden on those particular locations, but they were working through it. The citizens were very supportive of it because they realized it was revitalizing the area, right? But it had to be in that kind of potential where there's employment, there's housing. We know we have a housing crisis here. That's not just for those in the disability community. I have a real estate license, so I am very aware of the housing industry, not just from a buying perspective, but the rental market because of the condition of the buying market. And that plays into the immigration issues because when someone comes over here illegally, how hard is it for them to get housing if they're not in a sanctuary situation? So I've heard New York City is in a terrible, terrible mess from these sanctuary statuses that they've created for people. And then there's no viable employment, which is not good for the immigrant or for the community they're coming into.
Thank you. Housing, I want to get into that. That is a big issue. The number one call I get is
Yeah.
housing, and there's unfortunately, very little we can do as a center. We can get people on wait list, but that takes years for that process to go through. So, what do you think we need to do in terms of housing and making it more affordable?
So this is something that's a huge opportunity. We know that millions of dollars are funneled in behind candidates. And so part of my platform for election reform is to stop the PACs, right? So think about that. Those are private donors that could be supporting housing initiatives to build communities of affordable housing, to support in other ways. So every time somebody makes a $25 million private donation to a candidate, at any level. Remember, that's money that's going into that candidate's fund. And we've seen those funds used for legal slush funds. We've used them, seen now for dinners at Morton's on a regular basis. I don't know about you, but dinner at Morton's is a kind of a big deal for my family. That's not something we do every night. I was really, really saddened when I heard that come out recently. But think about that. All that money being funneled into these campaign funds could be out in our communities and helping our communities and helping homeless communities, unhoused communities, or to create affordable housing. Because what we're seeing is large corporations are buying single family homes and the prices are still skyrocketing. So there was a huge change in the real estate market recently regarding commissions for buyers and sellers, agents, but we didn't see the kind of legislation come through that helps the actual person looking to either sell or buy a home. So honestly, I think redirecting some of that money that's going into political efforts into kind of community efforts could be a big win for us, both at the state level and the federal level.
I know that one of the things that could potentially help is increasing the supply of housing. So is
Mhm.
there anything you would support to make it easier to build affordable housing? That is,
Yeah,
at the end of the day, it is a supply and demand issue at the basic level. So can you talk about your policy about that and what you think of that?
yeah. So definitely they're allowing small businesses more development money. I have seen more coming out of the New Jersey Small Business Administration and some funding for larger projects. So allowing people to be more collaborative on those projects. I know a lot of those in New Jersey, especially, is around the lack of public sewer, public septic, and septic systems, and those have gotten so expensive because of the housing market. So absolutely creating safe, but they have to be safe. So often what we see are, and I know we have one locally here in Cumberland County, we have a couple of them, they're Section 8 type housing, and then people feel like they're not safe. If you're building housing, people need to feel safe. They need to feel viable communities. We've seen this a little bit further north where they've created actual communities with shopping included, housing included, very accessible, very easy to get to, because we know we have a public transportation problem in New Jersey, especially South Jersey. So building those kind of communities that have places to shop, local services, all built into the community, I certainly would support those kind of developments, but I feel like they shouldn't be from one large investment corporations. I feel like they should be collaborative with the townships or the cities that they're being built in, along with private investors and the real estate industry.
Okay, thank you. And another issue that has garnered a lot of national attention and affects people with disabilities in terms of personal autonomy is abortion rights and reproductive freedom. And I know that is a national issue that,
Mhm.
as a senator, you would be voting on. I know New Jersey's laws are pretty progressive, but I'm curious on a national level what you think should be done in terms
So
of abortion rights.
it definitely, so I am a conservative Christian candidate. I tell people that all the time, but that's what's led me to serve or to look for this opportunity to serve. However, I am a pro-choice candidate. I believe that yes, there may be some things that we should legislate around late term abortions and only being medically necessary. And I think what people don't realize is this affects things like the morning after pill. It affects things like access to birth control. It affects things like IVF. So when you talk about this ban, yes, so New Jersey kind of lives in a bubble. We have these great laws that have really, really protected women's rights in this area. However, 4 years we've had an administration who is supposed to be pro diversity and pro protecting people, and they've done nothing about the fact that this has gone down to the states. Now, I have no problem with the fact that it's the state's responsibility to create legislation around this issue, because different states have different regulations around medical, they have different regulations around age of consent. People don't realize this is definitely impacted by age of consent and when parents do or do not need to be notified of a female that's going for a procedure. So there's a lot around this. I am actually trained as a confidential sexual assault advocate as well as a domestic violence advocate. So when people throw out statistics of only 2 to 3% of abortions are due to rape, that's not a real statistic. There's so many of those that go unreported, or many times women are forced into having a procedure because of a domestic violence partner. So men play a role in those decisions in a lot of relationships. There are many women that are sometimes forced into sexual situations, and because they are in some type of a relationship or know that person, they don't report that as a rape, right? So we really don't know what that real percentage is, and probably never will, because rape is such an intimate, shameful crime for women and for men when it happens to men. But when women then end up pregnant as a consequence of that, they're certainly not reporting that as a part of it for fear that they're going to have to then follow up with legal repercussions. So I am a supporter of definitely making sure that that right is protected, that things like the morning after pill and certain types of birth control are protected. I also would like to see states that are going to ban it have to put some kind of legislation in that then holds the men accountable for those births as well. So that takes two to make a baby last time I checked. So there should be some responsibility on the other side of the aisle, since I hear a lot more men vocal about anti-abortion legislation than I do women. And I really just feel like, if you want to be that vocal, then where's the consequences for your sex in that discussion? So I am definitely a pro-choice candidate. I feel like women need to be standing up and being vocal and supporting women that are in those states that have already put abortion bans into place. But when I discuss this with my pro-life friends, so I have some friends who are very much pro-life, I actually personally support some organizations like Cornerstone Women's Resource Center, that is because they provide resources to women who have chosen to keep their children. So that's where I support that part. However, as a representative, give unto Caesar that which is Caesar's. So this is a government issue. It's a legal issue. Somebody else's religious beliefs may not be mine. So I need to look at it from that perspective as a legislator.
Okay, you talked about healthcare at the beginning, and I was just curious what your policy is that you support. Obamacare, also really is called the
So
ACA.
yeah, so
Do you support Medicare for all? What is your policy on?
So I don't support our for-profit healthcare model. It's a failure. We've seen it fail. Now, affordable healthcare has done some great things, limitations on costs of medications for individuals. Unfortunately, what it also has spurred is a rise in high deductible healthcare plans. Prior to the Affordable Care Act, there was only about 19% of individuals had these high deductible healthcare plans, and they were mainly for part-time employees, small businesses that could not afford any other kind of insurance for their employees and wanted to provide some, would have these high deductible healthcare plans. At the implementation of the Affordable Health Care Act, it went up to about 32%. And if anybody doesn't know what a high deductible healthcare plan is, that's where you pay so much for your insurance, you have an amount that comes weekly out of your check, and then weekly, bi-weekly, however you're paid, and then you have a deductible that you must meet before anything outside regular routine blood work and an annual physical gets covered by your insurance. So for an individual, that can be anywhere from $3,500 to $4,500. For a family, that can be anywhere from $7,000 to $10,000. Okay, so think about this. In a two-family situation, and by the way, those rates went on 2020 from around 32% to, in some states, it's as high as 78% of individuals are covered by these high deductible healthcare plans. So think about this. You're a two-wage earner family. You both make $20 an hour. That's $80,000 a year. You have two kids. You now have $10,000 of deductible before your healthcare insurance even kicks in, right? So you're covering, ear infections, you have toddlers, anytime your child's sick, if your child gets hurt, anything outside of vaccinations and things like that are not covered by your insurance. So you really only have disaster insurance. And that's where we're turning to under the Affordable Health Care Act. I think we should keep what worked. And I think we should move toward, there are so many models for healthcare, European models, and we have technology. So we really could run these and say, up to this income level, you qualify for some kind of government funded. After that, maybe you don't. Maybe you have to supplement that with other kind of things. So I think we have to stop doing a one size fits all for the 1% to have the same system as that for those who are making less than $100,000 a year. Let's face it, it's hard to maintain a standard of living even on $15 an hour. I know we talk about that being really hard. It is hard on businesses because businesses are facing those same inflation costs, but that's $30,000 a year. So without some kind of supplementation to help cover basic Maslow's basic needs, healthcare, safety, security, housing, right? We need to make sure our citizens have those. I think in the end, most voters just want to make sure they have a safe place for their family to grow up, to be able to put food on the table, and to have the care, medical care when they need it. So I'm in favor of plans. So I don't want to say I'm in favor of Medicare for all. I'm saying we need to make sure that those who can't afford health care are not out on the street or unhoused. Now, there has been legislation put in recently to make sure that's not happening. That's a step in the right direction. But I think we need to look at other models around the world who have better health outcomes. US health outcomes are not great. So that tells you that our healthcare industry, and that right there is a problem. Healthcare should not be an industry. Pharmaceuticals should not be an industry. We should not be profiting off of people's health.
Okay, next issue I wanted to ask you about was transportation. That comes a
Mhm.
lot for people with
Yeah.
disabilities, accessible transportation, because that affects your ability to do really anything, get a job, or just live out in the community. So, what would you do to improve affordable transportation
Yeah.
options here in New Jersey?
So I think North Jersey definitely has better transportation than South Jersey. I've heard a lot of politicians talk about light rail. I think our representation here should be tapping into federal infrastructure monies that have been made available. We see them other places. At one time, there was a rail line that went all the way from Cape May to Philadelphia. Like, why, where has that gone? Right. So I think Atlantic City still does have a line that runs there, but locally, I know we have a few initiatives here with like smaller community funded buses that will take people to major transportation hubs. I think maybe more of those. Rural communities suffer the most. So, those who don't have access or need access to disability friendly transportation are pushed to closer to more urban areas, but making those kind of systems available, ride shares, those service cards to get. I know I worked on a grant program where we literally used grant funds to help a student who he would take an Uber to the bus because he was so far from a bus line in rural areas. So looking for programs like that, looking for federal funding to improve our transportation systems. Of course, we want clean energy on public transportation. So that's important. I think that would be the key. And again, just being able to help people in the disabilities industry, I mean, in disability communities, find remote employment or creating somewhere that they could work within their community in those remote jobs where they don't feel isolated. I don't want anybody to feel isolated. We are such social creatures. And I think that's really important. I think it's really important for health and wellness.
Yes, thank you. Another issue that is very important for people with disabilities is Medicaid, in terms of that's where a lot of people with disabilities get things like long-term care and caretakers and things like that. So what is your position on strengthening Medicaid or reforming Medicaid and giving people with disabilities more options to long-term care?
So, so long-term care, and I like the programs that help allow family members, right, to be actually employed as a caregiver, right? So what's more reassuring for someone than to have their own family member and those family members not have to give up the employment opportunity and then you're having to have a total stranger come into your house. So I love those programs. I love them for seniors. I love those for that have disabilities. I just think we have to be careful that they're not being abused, right? Because then that takes away funds from somebody else that needs to have those funds available, right? Again, it's a vulnerable population, so I'm definitely in support of making sure they have the people have the medical care they need to be basically sustainable. I do, as much as I support individual rights and things like that, I think there's a lot of what I would call not procedures that are required for people that are being covered by government. I think we need to look at, if you have basic medical needs, they need to be met, and making sure that people have those funds for those. And I think that could be built into that. Again, when you talk about that, overhauling the entire medical industry to no longer be a for-profit industry, because there's other industries that are cropping up where it's now your insurance. And this is part of what led me to run for office. Was I ran into the thing where my insurance was not even who was approving my care. They had farmed that out to another company. So now not only is my health insurance have to make a profit, this other company that's actually doing the approvals that weren't even medical professionals are have to make a profit, right? And then the facilities have to make a profit. So building in all those profits, you have to think, gosh, it's made everything so expensive. So if we could get down those costs by it not being a for-profit industry and closing down these other industries that are propping up around the medical industry, it could make it much more cost contained and allow for more benefits for everyone.
Okay, and I'll also ask you about as we begin to wrap up here, because I know you have other appointments, but I want to, and thank you so much. I want to ask you about another issue I hear about too is gun violence. That affects a lot of people with disabilities. So, what are your positions on assault weapons bans, on different gun safety measures? You know, those issues would come up as a national senator. So,
So
your thoughts?
absolutely a Democratic Republic candidate, right? So we have a constitution, we have the right to bear arms. That doesn't mean, so having a right does not take away the responsibility. So I'll use the example of the school shooting we had where the parent bought an AR-14 for their child that was already had been recognized as having some emotional issues due to the family divorce. So I was really, I first of all appalled by the fact that anyone would buy their teenager an AR-15. I understand people want them for collectors, for skills, for all kinds of things. So I don't want to put a lot of limits on it, but I do think that there should be background checks. There definitely should be education and training. I am a gun owner and I went through a training program to make sure that I knew safety, that I knew about securing it. I don't want to be a statistic where a child finds a gun. So I think education is key in that area. I am a supporter of background checks, right? So yes, somebody that has a history of mental illness should definitely not be able to own an AR-15, but people also overcome mental illnesses, right? So I think you have to put some guardrails around what kind it is. You know, I think that guns don't kill people, people kill people. I think if somebody really wants to hurt somebody, we've seen that in the past, they're going to find a way to do that. But I definitely think there are limitations. I've seen some initiatives for teachers to be able to be armed and things like that. And I think really you have to, those are local laws. Those need to be local laws. At the national level, I think we need to support the Constitution, and the states really need to get together on, because obviously if you can conceal and carry in one state and you go over a state line, it's really hard to regulate that. I think we need to get something together that is more on a national level regarding conceal and carry. How do you get those rights? How do you get those privileges? So I definitely want to make sure we stay in line with the Constitution, but I think there are some safety measures and education measures and requirements that we can put around gun ownership. I know the NRA has for years said that any limitations on guns is an impingement to our constitutional rights, but you know, life, liberty, and the pursuit of happiness has to apply to everybody. So you know, putting those things to ensure that everybody has a right to that is part of that balance of the Constitution.
Yeah, and you brought up, we'll end it with this because you started it at the beginning, talked a little bit of this, is mental health, people with mental health disabilities. And as you said, you know, make sure everybody knows people with mental health disabilities are more likely to be victims of violence than perpetrate violence. I always think that's important to push back on that stigma. So what would you do? And as a person with a physical disability, I feel like often people with mental health disabilities get forgotten in our community. So what would you do to improve access to mental health care? And what do you think kind of how we can reform that system?
So we have an epidemic of mental health wellness in our country. 30% of young women and girls reported feelings of sadness and even suicide. So mental health is the invisible disability. I've had individuals very close to me who struggled with things like bipolar disorders, schizophrenia, things like that. And people don't see it, right? So it's invisible disability. So access, and I think one of the things that has really hindered this area is those who do have a support system are hindered in many ways of being able to get help for people who have that disability, who from day to day their mental well-being can change. So some reform in that area for the people around them, being able to support them and get services for them, because currently the way it is, unless the individual asks for help or is a danger to themselves or somebody else, and at that point they're in crisis, right? So now you've let somebody go until they're to a point of crisis, similar to the rest of our medical community, right? Somebody doesn't get care until they're in crisis, and that's not the best way to address mental health, right? So easier access, more access, encouraging individuals, better pay for social workers is another way to do that, right? So a lot of people don't go into that industry because it's very personally rewarding. It can also be very personally stressful, but better pay in that area, incentives in that area. Again, when you start taking away that for-profit part, you can actually pay individuals better in those areas. So there's some redistribution that way. But definitely, I would support any kind of legislation that gave us more funding for communities to have wellness centers, activity centers for youth, right? Youth who are engaged. JT Burks does a great job over in Millville with youth. There's another organization right here in Bridgeton, but getting people feeling connected, because technology isolates and that increases issues for those suffering from mental health issues and disabilities in mental health. So that is the way I feel like would improve those and improve outcomes for those who suffer from those diseases.
All right, so thank you, Patricia. I want to give you a chance to say anything in closing, and if just so people know your information, please send it to me, and I'll put it in the
Okay.
description of this episode so people can get to your website and things like that. But anything you want to say in closing, and thank you so much for joining us.
I do have a website that has all my party platforms. I've probably, some photos of me around. I do try, this is definitely a grassroots campaign. If you see my thing back here, it says vote better, know better, do better. I'm trying to advocate for people getting less complacent. And I do believe so that actually that motto comes from a quote from Maya Angelou. When we know better, we do better. So in this case, for this election year, facts and data are really important to me. I think a lot of government decisions are being made by party politics. I'd like to see more facts and data in our government. And I hope people educate themselves on all the candidates so they can make better decisions, and we'll know better and we'll do better and we'll vote better. So get out and vote. I can certainly hope people get out and vote. I speak to a lot of young people who really don't know how the government works. And I'm like, people have died for you to have the right to vote. So please get out and vote. Take the time to research. You have all this technology, find the time to look at, and more important than the presidential candidate. So more voters come out in presidential years. However, it's your local candidates, it's your House of Representatives, it's your state representatives that really impact your day-to-day life and these issues that we've talked about today. So those elections are very, very important. And I do believe we need term limits. So that's part of election reform too. So I just want to stick in there. We've got folks that have been there for 40, 50 years. They're so out of touch, and this is the only career they know. So it's time to, it's time we put some limits around those for our legislative branches of government. Folks shouldn't be parking themselves there.
All right. Well, thank you so much for joining us. I really appreciate you taking the time to do this.
Okay.
And thank you, everybody who listened. Thank you for being with us. And as
Thank
we
you.
said, voting is just so important. So please, no matter who you vote for, please vote
Vote.
and be a part of the process. All right. Thanks, everybody. And
Thank
I'll see you
you.
next time. Bye.
Bye-bye.